Hello, welcome to my YouTube channel. Today we're going to talk about a very high yield topic which is frequently tested on the board exams. And I'll give you some solid information how to tackle a USMLE style question and how to augment your score in the optimal way. So let's get started. 67 years old woman comes to the physician because of 1 month history of diffuse abdominal cramps and worsening constipation. And her last bowel movement was 4 days ago, and the stool was hard. She has a long-standing history of constipation, and she typically has one bowel movement every other day. But this pattern varies from two bowel movements daily to one bowel movement weekly. She has stopped using a laxative because of the diarrhea resulting in fecal incontinence. Colonoscopy showed no abnormalities, and colonoscopy was performed 3 years ago. So, and it is a tangential point that you have to perform colonoscopy after every 10 years, starting from 45 years. Initially, it was 50 years, but now the US guidelines have been changed for screening colonoscopy, and now they suggest that the patient should undergo a screening colonoscopy at the age of 45 rather than 50. And you have to repeat a screening colonoscopy after every 10 years, starting from 45. So this patient is not having any risk factor, and she doesn't require any colonoscopy just after 3 years. So if there is abnormality in the previous colonoscopy, if you found polyp, if you found any growth, any tumor, any dysplasia in the polyp, so then you can perform colonoscopy earlier than the 10 years, like 7 years, 5 years. So there's criteria on the basis of the size of the polyp and grade of the dysplasia. You have to decide on that criteria when to perform the screening colonoscopy if you find any abnormality in the screening colonoscopy. So this patient's screening colonoscopy was normal, and it was just 3 years back. So you don't need to perform a screening colonoscopy at this time. Anyways, so the patient had major depressive disorder, and these are treated with sertraline, and sertraline is basically an SSRI, serotonin, selective serotonin release uptake inhibitor, and lorazepam, which is a benzodiazepine. She does not appear to be in distress. Her temperature is fine, and she's almost quietly stable with a bit hypertension. The abdomen is soft, non-distended, and non-tender, and bowel sounds are decreased. Rectal examination is also fine, and patient is negative for fecal occult blood. And the question is asking which of the following is the most appropriate next step in the management of this patient. So I have highlighted some of the phrases in this clinical vignette. I'll try to explain them later on. First, we have to decide which option is correct. So X-ray of the abdomen, CT scan of the abdomen and pelvis. Option C is discontinuation of the lorazepam. Option D is discontinuation of sertraline. And option E is trial of acidophilus. And option F is trial of the fiber supplementation. And option G is colonoscopy. So the correct answer here is trial of fiber supplementation. Why? So I have highlighted that this is a 67 years old woman. So here the diagnosis is irritable bowel syndrome, IBS. So why it is IBS, I'm going to explain it. So this is a woman. IBS is more common in women as compared to male population. I'm not saying that male cannot have IBS, but IBS is more common in female gender rather than in the male gender. And then she is having abdominal pain. So then again, it is the diagnostic among the diagnostic criteria of the IBS. So the diagnostic criteria for IBS is you must have abdominal pain, and you must have a change in frequency and change in frequency of the stool, and you must have change in consistency of the stool. So abdominal pain and change in consistency of the stool and change in frequency of the stool, and also the symptoms are related to defecation. They are relieved by defecation. So if two of these three criteria are fulfilled, then you label the patient as IBS. So this patient fulfills the criteria. So she is having IBS. She is having abdominal pain, change in frequency of the stool, and change in consistency. Like I have highlighted here that she is having a hard stool. The stool was hard, right? And previously she was having diarrhea, right? So there is change in consistency of the stool, and again there is change in the pattern of the bowel movement, right? So this patient fulfills the criteria. And furthermore, they have mentioned that there is positive history for some psychological disorder. She is having major depressive disorder because IBS has an association with the psychological disorders. So this is a clue here. And then these findings are very important because this is a quite old patient, and like if there is some constipation or some change in the bowel movement associated with melena or fecal occult blood or weight loss or nocturnal diarrhea, then you have to think, okay, these are the red flags, and I have to explore the underlying cause, right? But in this case, none of these red flags which I've mentioned is present. So you don't need to investigate thoroughly or extensively. And all these features present in this clinical vignette are suggestive of IBS as the likely cause. So all you are going to do is give a trial of fiber supplementation, right? So X-ray of the abdomen you are going to perform in case of intestinal obstruction, right? So if the patient presents with intestinal obstruction, or if there is perforation, sign of peritonitis, so you're going to perform an X-ray of the abdomen. So air under diaphragm you can detect by performing X-ray of the abdomen. Or if the patient is having intestinal obstruction, so you can identify the dilated loops of the small intestinal tract and air fluid level on the X-ray of the abdomen. So this is not the case here. The features of the intestinal tract obstruction are not present in this clinical vignette, so you can rule out this option. CT scan of the abdomen and pelvis. Okay, CT scan of the abdomen and pelvis you can perform if you suspect any malignancy, any tumor, and suppose some tumor is found on colonoscopy, right? You perform colonoscopy and you found a tumor. So then you can go for CT scan of the abdomen and pelvis. At this stage, you don't need to undergo a CT scan of the abdomen and pelvis, which is an expensive test, right? So you can rule out this option. Discontinuation of the lorazepam and sertraline. So this patient is having a history of major depressive disorder with anxiety. So you're not going to discontinue these medications because it can result in rebound major depressive disorder and anxiety. So you have to titrate, you have to taper off these drugs if you have to discontinue. And there is a separate criteria. I'm not going into that detail, how and when to discontinue the antidepressants and anxiolytic drugs. So you are not the key here is this, that you are not going to discontinue the drugs all of a sudden. You must have to taper off these drugs. So these are the wrong option. You can exclude them. Then trial of acidophilus. Acidophilus is basically a probiotic, which you can say is a friendly bacteria, right? Which are friendly bacteria, and they are helpful. There is a little evidence that they can be used to reduce the symptoms of the diarrhea, but these are not the first line agent. And concerning this patient is considering this patient is having IBS. So you must have to give a trial of fiber supplementation. You must have to counsel the patient to reduce the level of stress and some lifestyle modifications. And then you can give some antispasmodic drugs. So this is the management of the IBS. And colonoscopy, as I mentioned, that if there are some red flags like there is nocturnal diarrhea, and there is a very important point that usually the diarrhea of the IBS is in the daytime. It is not going to present in the night time. So if the diarrhea is presenting at night time, you must think that there is something abnormal. You have to explore the cause. You have to investigate the cause. So I'm going to tell you the red flags. So if there is nocturnal diarrhea, if there is weight loss associated with diarrhea, if there is jaundice associated with it, and if there is intestinal sign of intestinal obstruction associated with it, and you perform a test for fecal occult blood, and that test is positive, and there is melena, and there is a microcytic anemia because of the iron deficiency, iron loss. So you have to perform the colonoscopy, right? So and I can give you another tangential point, very high yield important point, which can be tested on your exam, that if there is an old man or old lady who present with microcytic anemia, so you have to perform colonoscopy, right? So because most of the gut tumors, they bleed, and because of the bleeding, it results in microcytic anemia, and you have to perform the colonoscopy. I hope you enjoyed this video. Please give this video a like, share with your friends, and subscribe to our YouTube channel. Thank you so much.